person with borderline, if I'm interacting with them, I don't always know where I stand. Am I the good person today? Am I the bad person today? Do you like me?
So borderline personality disorder is a personality disorder where the person is somewhere between neurosis, so that's just like kind of a person that's like typically worried about lots of different things, and psychosis, where a person is out of touch with reality.
So some common ones are intense irregular mood shifts, engagement in self-harm or having suicidal thoughts, fear of abandonment, struggles with relationships, a chronic sense of loneliness. You know, some of those are really pervasive for some of these people.
People with borderline personality disorder oftentimes have really unstable relationships because they see things in black and white or all or nothing. So they might see their best friend and their worst enemy, and it makes it really hard to maintain a meaningful relationship.
They can get involved in all sorts of dysfunctional behaviors involving alcohol or drugs or spending or sex, have dissociative episodes where they are really out of touch with reality. And so it's a very tricky personality disorder.
So a lot of the symptoms of borderline personality disorder overlap with symptoms of other mental health disorders. And you really have to look at the specific symptoms of each of those other disorders that you might be considering, and you'll see that they don't quite match up. So people with bipolar disorder, for instance, are gonna have major depressive episodes that fit with specific diagnostic symptoms. And they're also going to have manic episodes that fit with other specific diagnostic symptoms that are not fully in keeping with what borderline personality disorder looks like. People with borderline personality disorder don't often suspect that they have it. So they might be going to a therapist or a psychologist or a psychiatrist for some other question or concern, and it might be revealed during that evaluation that borderline personality disorder is a concern.
The most effective known treatment for borderline personality disorder is a treatment called dialectical behavior therapy, which is a cognitive behavior therapy treatment at its core with some additional pieces added in, like real hardcore mindfulness training and really learning about validation and problem solving and change strategies so that you can really recognize that the person is doing the best they can. So we're balancing this idea of accepting people where they are and pushing them to change. And that difference in this treatment has been shown to be really effective and decrease self-harm and decrease suicidality and increase ability to regulate emotion.